Well, she's a doctor who specializes in taking care of people who've been hospitalized. As Natalie Wilson learned, where she works is significant to why she entered the medical field in the first place.
Dr. Brooke Williams' relationship with Novant Health Forsyth Medical Center goes back long before she was wearing this white coat.
I was actually born here in this hospital.
It was during the Winston-Salem Natives Youth that she began to understand the value of compassionate care.
I grew up in this hospital, and it really does make a difference when even if the provider is not delivering the best news, but the patients feel heard, the family feels heard.
She still remembers the many times her family would come here during her Aunt Cassandra Jones's sickle cell pain crises. She passed away from the disease when Brooke was in the 8th grade.
I remember just, promising on her deathbed I would go into medicine.
So she could be to someone else what her aunt's healthcare team was to her family.
I knew I wanted to have that same type of imprint within the community.
Years of academic dedication and persevering through the most challenging seasons.
A lot of times where, I didn't think that I would make it.
Have all led up to where she is today, back where the journey started. Now serving her hometown community as a hospitalist at Novant Health Forsyth Medical Center.
We see patients from the emergency room up into rounding on the floors. So anytime traditionally when a primary care provider would come see their patients after rounding in the clinic, we actually take their places instead of coming from the clinic. We are their counterparts here at the hospital. But, honestly speaking, most of the time when we do see these patients, these are things that we could have more than likely prevented.
Brooke says mentors have been important for keeping her encouraged when she didn't think she'd reach her goal.
Now I'm actually seeing their patients, so it's a real, full circle.
She's investing that same kind of support in others through the nonprofit organization she co-founded called Color of Medicine.
Desiree and myself wanted to make it a mission to help increase minorities in both medicine and the STEM fields. We both come from mentorship, and we wanted to make sure that we are representing people that look like us, but also helping to reach back and help pull them forward to where they want to be.
It's a mission with broader implications. Research has shown positive connections between how patients have viewed their relationship with a doctor of a shared racial or ethnic identity, a need healthcare systems across the country are trying to address, especially in communities that have consistently expressed not feeling seen or heard.
My colleagues are trying to improve their rapport and their relationship with patients. And yes, it does make a difference when they see someone who looks like them, but we are striving to improve health equity by making sure that we are training people on diversity and inclusion and that we're treating everyone equally.
Well, you can learn more about the mission of Dr. Williams' nonprofit by visiting colorofmedicine.com.